I have palsy.
Oh my god, you look fabulous.
No, you can tell a difference. I can't feel my face. Happy Friday, everyone. Welcome to Out and About Podcast. I am here solo today because Trish is under the knife. Now, when I caught wind that Trish was going under the knife, I said, you know, I can't have her be the star. I have to steal the thunder. She's getting new shoulder surgery this week, as she says. Now, we also talked about that. There's nothing more white trash than an adult injury. So she's going to be out of commission for quite some time. So I'll be here solo, but I'm not going to be here alone because I did have a special guest coming in today. Now, again, Trish has all the glory today. She's getting going under the knife, the general anesthesia. She's going to have an IV. She's going to probably have, you know, a bedpan. So I said I can't have her get all the attention today. So I called in my good friend Christina from Sperling Dermatology to one up her. Welcome to the show, Christina.
Thank you for having me.
And who was your friend?
This is Gabby. She's
Hi.
one of my colleagues.
Gabby.
Yeah.
Yes.
Now, Gabby is dressed like a Hershey's Kiss today.
Yes. That's the mood I was going for.
So thank you for being here, ladies.
Thank you.
We're going to talk some pop culture first and just kind of see what's going on. We're going to talk all about plastic surgery.
Love it.
And now you were a plastic surgery assistant for many moons, and now you are a general aesthetic.
Yeah. So I'm a board certified PA. I'm an aesthetic injector. Gabby is too. We both work at Sperling Dermatology. I work in Red Bank in Montclair. Gabby works in Montclair, New York City. So yeah.
Now, Vinny's also a certified injector. He injected his girlfriend twice last week.
How did that go for you?
Right in her coochie.
Successful?
Yeah.
Very successful.
Okay, good.
Yeah, so we're going to answer questions. Not questions. We're gonna talk all about the hot topics, all about, you know, improving your look via injectables and what procedures can get done, things we can get done non-surgical, you know, all that stuff. So we're going to talk about how to improve our looks and growing age gracefully.
Yeah,
That's right.
Going gray.
Going gray. No, we don't want to go gray.
We're aging gracefully. But yeah, so basically I just want to make sure that I'm getting the attention and Trish is not.
Exactly.
You know, in all seriousness, we do wish Trish
Hi,
well with her new surgery. Now, she said she's getting her shoulder fixed, but I guarantee she's getting rhinoplasty.
Yeah. Something's going on.
Rhinoplasty, FFS. Facial feminization surgery, top surgery, bottom surgery. Maybe she's having that spinal bifida finally treated.
Perhaps.
We don't know, but we have a whole bevy of things here on the tray, and I'm very excited to get started. But thank you for coming. Last time I saw you, now Trish had a lady come here the other day.
Yeah, I'm not happy about
Queen
that.
to get Botox. It's fine.
We're gonna get.
I just said, you know, I'm contractually obligated
okay.
to only work for Sperling Dermatology. I sold my soul to the devil, quite literally.
Yeah.
You ever see Death Becomes Her? When they drink the potion?
Yes.
That's basically what happened when I that fateful day when I walked into Sperling Dermatology in Red Bank, New Jersey. You know, I got a mysterious email from a gentleman. It says, "Oh, please come. We want to give you the fountain of youth." I said, "Okay."
Yes.
And years later, I'm still.
Look how fabulous you look.
Well, everyone says, you know, I think everyone says that I look younger than I am. I'll be 50 this year. And
no,
I'm 45. But everyone says I look younger.
You actually don't look that.
I know.
You look like low 30s.
Thank you. And thanks to Sperling. But everyone says it's because of injections, Botox, and all the other things. But it's actually, if you just keep an extra 75 pounds on you, it puffs out all the wrinkles.
Yeah,
Got it.
You don't even need filler anymore.
That's right. Yes.
So.
No, but you're doing amazing. And honestly, what I love about you is then when you do it in a more natural way. You don't because you look at celebrities sometimes and they're like overdone, botched, overpuffed. And it's just like, girl, what did you do?
Yes.
You do it in a good way that you still look like Joey.
You could say Casey Smith's name here. That's fine.
I wasn't thinking of her. No, not at all.
No, I know what you mean. But I totally agree. But thank you for considering me a celebrity. But today we do need to up the ante because it's been like, you know, it's been about not a year. Has it been a year?
It's been a hot minute.
It's been a hot minute since I saw you. Last time we did, that's when I had to shave my face and I looked like.
Yes, we did a little jawline filler on you.
I looked like Rosie O'Donnell.
Right, we did a little cheek contour, and you always like a nice cheek pap, a little definition.
That was the most intense one we did since.
Yes.
She had a needle the size of this fucking pole stuck in my throat. She was like this. It was like.
Yeah, and I was like, "Don't breathe,
I literally
don't
had
move."
to deep throat the needle without my jaw.
Yeah.
But yeah, so today we're going to be doing my monthly maintenance. How long should I be getting my touch-ups?
Yeah, so you really should be doing your Botox or Dysport. We kind of offer both neurotoxins.
Dysport's more for for boys? 'Cause it's stronger.
Yeah, I like Dysport for men because it's a little bit stronger. But both of those medications are medications that we use to soften the wrinkles of the forehead, the frown,
A botulinum toxin.
give you a little bit of an eyebrow lift. And you should be doing those every 3 to 4 months if you like it. If you don't like it, don't do it. But hey, who doesn't like it, right?
Can I ask a question? I know that a lot of it's always before I got Botox, I always thought it was such a foreign thing. Because you don't really know anything about it. Like, I think the main thing on every girl's and guy's mind is, it seems like such a elaborate, expensive thing. So, like, I think, can you like demystify like what the pricing looks like, not just with Sperling, but just in general, like, and what units mean. Like, I know people call like, I'm seeing these TikToks, all of TikTok saying like making fun of like what it's actually like when you call a plastic surgeon's office, like what people are asking, like how much does this cost? People just want to know how much it costs, what they're getting for it, how much it's going to save. Because people say, oh, it's per unit, it's $10 per unit. Like, oh, $10 for Botox, and you get there, it's literally like so you need to kind of demystify what pricing looks like for. And I'd say our average man mafia members between 25 and 45 or 50.
Can I answer this question? Because I love this question. I answer it all the time.
Demystify for our girls.
Yes,
around
I'm going to
25
demystify
to 45.
So because Botox or any type of toxin is usually done like every 3 to 4 months, people do it like quarterly, they say. So like every like 3-4 months, that's like 3 times a year, maybe 4. Think of it like if you're a woman, you're getting your nails done, or man, whatever. I pay like for my nails to get done every 2 to 3 weeks, and it's usually like, I live in Jersey City, and I know New York is probably even more than what I pay.
It's expensive, yeah.
So it's like $60-$70 just for a manicure.
But every 2 weeks.
But every 2-3 weeks, and if I chip it, then it's even sooner.
Yeah.
Exactly. So comparing the two, it either comes out like almost the same in price over the course of a year.
That's getting your nails done.
Exactly.
Correct.
Or
Lashes.
it's even a little cheaper.
How much those fake lashes cost?
Oh my God,
Those
those fake
lash
lashes.
extensions.
You got to fill. It's like $100 every 2 weeks, not $80 to $100. But no, what Gabby's saying, yes, $100 a month if you really have to think of girl math. Or when you come every 3 to 4 months, you're spending between $400, sometimes even up to $600-$700. Really depends on your units and your dose. It's so hard because you're right. People call in, how much is mine? I can't see over the phone. I don't know how many wrinkles you have or how many units you need. We really need to see you in person, but people can expect to pay between $400 to $700 every 3, 4, 6 months. Really depends on you. But if you spread it out per month, it's pretty much almost $100 to $200 a month, maybe kind of what you're spending for your lashes or your hair or your nails, if you really want to do the girl math. But
you can do your nails yourself. There's nail kits at home. You can't do Botox
there's so
yourself.
Many things.
Well, in certain neighborhoods you can.
And there's so many things, like we work with patients, like we have financing options, so you can pay monthly.
You do?
Yeah, we could do
you
finance.
You can lay away for your lips.
You could do so many. We have like Affirm, Klarna, Cherry, all those things. So you could do.
Do you take EBT?
Maybe.
I pay for my rhinoplasty with Care Credit. That's awesome.
Yes. And the company that owns Botox and Dysport, they have like these rewards program. Every time you do these things, they give you like $20 here, $50 here, $75 here. So a lot a really take advantage of
Is it true that the Biden administration paid you to put the vaccine inside these Botox things, so they're unwillingly getting the vax?
No.
Okay. That was what I read on my
yes. False.
On my page.
Fake news.
Let's talk about lip injections a little bit. What does pricing look like for lip injections, and how often do you have to do? Like, say, I think initially getting over the hump. Like for me, like those numbers do sound crazy. Like $700 every couple months or whatever does sound like a high price. But like once, and even when I heard that, it was like it seemed expensive. But after I first did it, I realized how you get so much bang for your buck when it comes down to it. And people think you have to, once you start, you're not gonna be able to stop. What's the debunk the thing about like once you start, you can never stop.
No, you totally don't have to do it every 3 to 4 months. Right. It's like when you dye your hair and your roots come in. Like, do you want to wait till more roots come in, or you want to like fix it? Of course, you want to fix it, but you don't have to, right? So no, some people come in every 6 months. Some people just see us once a year for Botox. It's up to you. Do your wrinkles come back worse? No, they come back to what they were before. So. You're just
older by that point because you age.
So you don't have to do it every 3 to 4 months. We have people that sometimes spread it out to every 6 months or sometimes just once a year just for like a nice event that they want to look good for.
Okay,
Nothing wrong with doing that.
All right, let's talk a little bit about lip injections. Yes. So everyone's been in Hollywood. Everyone's talking about these lip injections. There's a lot of things going on right now saying about people dissolving their fillers and getting the fillers. So with lip injections, how permanent are they? What options are there for girls? Is there semi-permanent options? Are there more permanent options? And what's like, tell us all about lip injections and what you recommend for, someone looking to get a filler look with their lips.
Yes. So most fillers are made with HA gel, which is dissolvable. So almost all fillers out there are all dissolvable. They're not permanent.
Dissolvable meaning that it'll dissolve on its own, or like it's able to be dissolved if you need it to be?
Either or. If you wait for a year, it just kind of goes away on its own, dissolves on its own, metabolizes on its own. Or if you hate your lip injections, you can get it dissolved by an injector because you just hated the way it looked, right? So you're never locked in permanently with lip injections. But it's a gel that we put into your lips to help shape your lips, help volumize them, help define them. If you have a flat lip and you want a heart-shaped lips. And usually we'll give you one syringe and it lasts you a good year. Okay. Some people want to go big. So sometimes they need 2 syringes or 3 syringes. And a lot of people say a syringe sounds like a lot. Is it really a lot? It's 1/5 of a teaspoon.
Which is a blueberry.
It's not a lot to get one syringe. So sometimes when you hear, I got 3 syringes done, you're like, girl, you probably look horrible. No. People still look fine with 3,
Syringes on that table. I'm excited.
Yeah, exactly.
And then, are there more? What are the things that people are asking for? If they want something like a stronger, what should they be asking? If they want something less permanent, what should they be
what's
asking
cool
for?
about our fillers out there, a lot of us injectors know, is that there's so many different fillers. Just like when you do your makeup, there's so many different blushes, right?
Oh, right.
You'll pick like a little more rosy blush for this type of girl, or maybe like a subtle blush for this girl. With filler world, we know there's plumpier ones, there's thinner ones, there's flexible ones, there's like more, formed ones. So that's our job as the injector, to kind of like listen to what you're looking for, and then I can match the filler that I think will give you that look.
It's not one size fits all.
Right.
Ooh, fill me in, sis.
Yes.
That's exciting. What do you think the trends are right now in Hollywood? Like, remember last time? I think last time we sat down and spoke, it was all about the fox eye, the Bella Hadid fox eye, and that was kind of a tighter pull thing. What are we seeing? What trends are we seeing in Hollywood? What are things that are like people can go to injectable? I'm sorry. What are some trends that people can go to their injector and say, you know what? I would love to look more like this. Is it Sydney Sweeney's
I feel
jugs?
like it's masseter Botox. That's like the newest.
What is it called?
It's called masseter Botox.
Ooh, school me in, sis. Master
Masseters. Yeah. So basically, like, your masseters are part of your muscles that make you chew or grind your teeth, or if people have TMJ. So usually they can get.
I have all drug addicts listening to this, so everyone's high anyway, chewing their own face.
So, like, usually people come in and they say, oh, I've heard of like masseter Botox or Botox for my jaw.
Here she is.
So, yeah, it kind of slims the face.
That's after what? That's the same day?
Yes.
No
not
way.
the same
No,
day.
it's the
That's
same
after
day.
1 to 2 weeks of it kicking in. But you see her masseters. So Bethany Frankel actually had this look a few years ago. Well, years ago, and she had some like a square jaw because she had large.
She looked
masseters.
like SpongeBob SquarePants.
So what you do is you can put Botox in these muscles to shrink them.
Oh, look at that!
Exactly.
Yes, and you
Holy
can get what we
shit.
call a jaw slimming.
And you can really see like the
Bitch, why
difference
did you
between
just
like the
slim my jaw
bottom.
yet?
you don't have them.
Oh, I don't have it. Oh.
Let me see. Let me feel.
Well,
now bite down. They're not that strong.
Oh, look at the difference.
Now hers
she
are
looked
very
like a
strong.
fucking Lego
Right.
before.
So hers are very strong. Well, they were strong. They put Botox in. She probably suffered from
you don't
grinding
think it's
or jaw
that
clenching.
stacked angled bob that's doing all the work, Mama?
I mean, perhaps it's helping,
It
but
adds
you
to it.
can you can definitely see her jaw
Wow.
slimmed up. She went from a
so
square
what are you actually
jaw.
doing though? That looks like a muscle. Are you removing the muscle?
No,
or are you
You
putting,
relax it.
Yeah, you're putting Botox in it to shrink it. We're relaxing it and we're shrinking it because it's overstimulated.
this is gonna go good. I've never heard of this.
Yes. Oh, so this is called jaw slimming with Botox. There's a lot of uses for Botox.
Yes.
That we can talk about. We can talk about gummy smile. Miley Cyrus has the famous gummy smile. When she smiles, she's got a little bit of gum show.
My friend Trudy Lou recently got a lip flip
Yes.
and had her
Right.
gums, but she goes exclusively to Dr. Sharon Giese.
Yes.
So we're not allowed to,
That's
we're not allowed to
okay.
talk about that on here.
But what happens is we have our some people have very strong lip muscles that pick up their lip when they smile. It shows a lot of gum. And so people don't like that look. So we'll put Botox in that muscle to say, don't pick up so much, relax a little bit. So when they smile, they don't get too much gum show.
I cannot believe this. Say that name again of the Bethany Frankel syndrome.
Syndrome. So that's masseter Botox, jaw slimming with Botox. We call
Ladies,
it.
if this is this is a visual podcast. If you're not, but otherwise Google this. This picture is insane. She looks like a Lego head beforehand.
Yes.
Yeah.
Oh my god.
It's very boxy. It makes people look really
boxy,
boxy. She
right.
actually just did my master Botox a couple weeks ago.
Yeah, she had grinding. She had jaw
Yeah, I
clenching.
did.
So it helps symptomatically with your symptoms too. If you're a clencher, if you grind your teeth at night, you get
Diego, you're a clencher,
headaches.
correct? Diego has a double-walled sphincter. Believe it or not. We need to relax
So
those
I've
muscles.
heard.
Where else can you use? Well, I know you can use Botox for sweating.
Yes. So we put it under your armpits. We could do palms of hands.
feet.
We can do feet. We can
I don't think it's very comfortable.
Yeah.
Though,
You know, you can do
Hand sounds like it hurts.
yeah. We can do your traps to slim your traps if you have like kind of muscular type traps and you want
Not
that
me,
like
sis.
slim
I'm a
silhouette.
broad-shouldered
Broad
bitch,
shoulder.
so I need
Yeah,
it.
broad shoulder bitch syndrome. Yeah.
Oh my God.
Yeah, so there's
The
a lot of
nose?
uses.
You can do it in the nose.
We can do it in the nose to help your flaring, to thin out your nose, help the tip go up a little bit.
Oh my God.
Tip.
Little Botox rhino.
We can do it in the neck to give you a tighter neck. So some people, when they talk, if you want to look up neck bands with Botox. So I'm giving him chores
I
now.
know. She's flirting.
It's like the Nefertiti necklace.
Yes, so some people,
Nefertiti?
so then when they
Oh.
talk, they have these like bands that kind of like pull down their jowls and their face, and we can put Botox
Oh my
in
God.
these things.
Or like
These poor-
tech neck.
Yeah.
That
Do
helps
the
with
other-
tech
do the
neck.
next
I would never
one?
get this procedure
This-
just so I
this
don't have
right
to make
here.
this fucking face. These poor women.
So you see the bands, we can actually.
That's what Poppy needs.
Yeah. So it's actually really good with people that are starting to see laxity, loose skin in the neck because
That's
it's
just
pulling
Botox
down.
underneath your chin?
That's Botox in her bands, in her neck
Your neck
bands.
bands.
Yeah.
Oh.
And look how nice that neck looks now. It's tighter.
I'm going to get that for Poppy as a stocking stuffer.
Yeah, definitely.
I
That's a
love
good
that.
one.
Well, I'm excited to get started today.
Yes.
I'm going to be getting my overhaul. I know I use Dysport because it's stronger and I'm heavier and bigger. Come on in, Liam.
Hi, Liam.
This is my good friend Liam.
Hi.
He's an amazing producer. He does a reality show called Stool Scenes. It's like The Office.
Oh, nice.
Would you like master Botox? Is that something you're
Would you like
interested in?
some Dysport
Some
or
jostling
Botox?
Botox?
No, he doesn't have a SpongeBob square head. But so today I'm going to be getting. I need my 6-month refresher. We're going to be doing my
Correct.
Dysport.
Yep.
We're going to be doing that first and ever. Now I was on the record for many moons saying that I was strongly against men getting lip injections.
Yes.
Because the look of it. When a queen gets a fucking one syringe of fucking filler on her lips, they start lisping
They're like
away
this.
and starting
Yeah.
getting the actor. It
much.
ups the gay factor. It
Yeah.
makes you gayer than ever. It's like super gay. And look at it. I mean, look at this already. I can already tell what that bottom one sounds like. Look at it. It's like
Yes.
instant.
So we don't want anyone.
It's a feminine look.
Correct.
I don't want. I know you can't control it. I'm not trying to get that kind of feminine look, but you see where I'm missing. Like I'm getting it because I'm looking older. I'm for an age thing, not for a sexy thing. I'm not trying to get like a sexy pout like these queens here, like looking like.
No,
Like
absolutely.
I'm a supermodel or
We
anything.
don't
I'm not
want
trying
you
to do that. Like that looks ridiculous.
We're not going to make you look like a duck.
He doesn't even need lip filler.
Yeah, he really doesn't.
But for
need
me,
it.
I'm just doing because as you age,
I think you need a little definition and just a little like replenishment of hydration. You're just losing a little hydration. It's
Was
getting
that
a little.
shade? I told you I bought this Prada lip balm. This is a $60 lip
Yeah, you've
balm.
been lubing
Yes.
it up over there.
Yeah.
I know. Well, I wanted to treat myself to my new lips. When my new lips are here, I wanted to know you're born into a rich family.
Right.
Right.
Now, I will warn you is after we do inject, even though we're going to do a small amount, you will be swollen today.
Oh,
and
it's
that's
okay.
what I like to tell a lot of people.
No, don't go too small. I want to be able to see it because I don't want to I'm gonna get
Yeah.
poked and prodded and not see anything.
But the swelling will go down. So even if you feel like it's a little too big today, don't worry. Give it 2 to 3 days, and then you're. Really
I'm not
gonna
worried.
love
I know
it.
it'll go down. But
Yeah.
but I'll see a difference with the amount you're
for
doing.
sure, for sure.
All right, good. So I was gonna get lip injection for the first time. Also going to do the lip flip. Oh, look at that guy. Okay, bottom, all the way to the bottom, all the way left.
Bottom left.
The second one in. That's what I like. I think that's
Yeah,
good
that's
for
nice.
me.
Perfect. That's
It looks
definitely
like
something
me.
we can
It's like
do.
enhancing his
Yes.
natural features, which is what we
Yes.
try to
See
do.
how
with
this
everything.
looks. So if you guys again visual episode girls, go over
Yes.
to Rumble or YouTube. This is what I'm talking about. See, he still looks masculine.
Mm-hmm.
It doesn't look like he's gonna lisp and call you sister.
Right.
So this is what we would call a mini pout. We wouldn't really do like a full syringe. Maybe we'll do like a half syringe or a little less than half.
Well, I'm a little more than that.
Yeah.
I do want a little sassier than that.
Yeah.
But you know what I'm saying. I don't want to look like I'm about
got
to
you.
like work a glory hole.
I got you.
We're gonna do that, and then we're gonna do something else. I told you my skin was. I believe I said I looked like I was sleeping under
Under a bridge?
underground
Under a
a
bridge. Yes.
I'm very dry. I get dry patches. See, look here. I got dry patches. Now she's
Yes.
she's a combination queen. She has been for many
Yes.
moons. I'm getting dry patches here. The texture here is like.
So we need to really resurface your skin. Okay, you need some resurfacing. We need
can't
to get
do that here in the office. But I'm going to go over.
We're gonna have you go to Gabby in New York City, and we want to give you a nice vampire facial or something else that's kind of like the vampire facial on steroids.
Vampire facial. Now this is a big taboo subject. We're not going to do this here, but when I do it, I'm going to bring you girls along. I'm going to do an Out About adventure, and Trish and I'll go over there and get vampire facials. So this is now Kim Kardashian made this popular back in the day. Now, this has plasma, this has blood. It looks more dramatic than it is because it is blood, but you're not bleeding.
Right. You don't leave the office bleeding. We don't want you to leave the office. We're going to clean that off.
When you see the vampire facial, that it looks like that's actually the blood coming out of your face. It's not. It's blood that you take from your veins and then they put it over your veins. Explain to them what this is and how it works and the proprietary measures that it takes for this procedure, Mama.
Yeah. So what we do is you come in, we take a vial of blood from your vein in your arm, we spin it in a centrifuge, and this liquid gold comes to the top. It's all your good growth factors, your proteins, and we're gonna drill in some little needles called microneedling, aka the vampire facial, on your face, and it kind of makes little holes for seeds to go in. We're gonna place that liquid gold, and that's why you get that bloody look. But what we're doing is we're causing little wounds to create collagen stimulation. So we're
an anal fissure.
Yeah. We're aiming to resurface your skin. So someone who has pores, someone who has acne scars, rough texture, dry patches, you want the airbrushed smooth look. This is perfect for them. We say this is like the Instagram filter, like you wake up looking like you have foundation and even skin.
Why have you never forced me to do this? Because I had good skin problems.
I tried. It's really hard to book you.
It was far away. I love Red Bank, New Jersey, because it's a great, cute town. If you're in the New Jersey area, the Red Bank location is by far my favorite out of the Sperling Dermatologies, because it's just a cute little town.
Yes, I love it.
So I couldn't make it down there, but now that I have Abu Gabby here,
yes, Hershey Kiss.
I'm gonna go over there. Vampire facials. That's one. Now, what does that pricing look like for people?
Yeah,
that looks like it'd be expensive because there's molecules, there's like machines involved.
Not really. I mean, so you could get a vampire facial for about $1,600, $1,800. All 3 treatments.
$1,800.
Last you a year. Last you a whole year.
Well, it's 3. We're talking about 3 treatments, not just one.
You're gonna get a venereal disease because you're gonna be using used needles.
No, we would not do that.
Not at your place. I'm saying if you go on a discount.
If you go to a questionable place.
Oh, so that's a lot. So then how long does that last you?
About a year, sometimes 2.
So that's about $2,000 if you're at a place.
Yeah.
Oh, that's okay. That's
But people really like this because it's their own stuff.
Yes.
It's coming from themselves.
And
so it's
how
not
okay, so I'm doing girl math. I'm doing like man mafia math. I'll call it that. I know my girls are thrifty. I know it's $2,000. That's a steep price. So I'm saying, what is the ROI on that? Like, what return on investment? Like, are you going to see? Are you going to see how much of a dramatic change are you going to see? Is it going to be like, you see like cool sculpting? I loved cool sculpting, but I'm fat and I didn't really keep up with it. I didn't diet. You got if you're gonna really want something done, you go right in and nip it in the bud with fucking suck it out. I think this is the sucking it out of like.
I think the ROI is you're not going to spend as much on makeup because you're going to have that no makeup look that like you're going to love. You're going to wake up and you're not going to feel like I have to put foundation to cover this pore up or this blemish off or this, I got to do this to zhuzh myself up. You're not going to need that as much because we did that for your skin originally. So you wake up kind of looking beautiful.
You'll see a percentage difference like of improvement. How much percentage do you usually see with this after? How long does it take to see?
So it can take like 2 to 3 months to really see the nice turnaround in the skin. Yeah, it takes a little while for the skin to really start regrowing.
That's when I would start giving up hope. This is why I would never tell you. If I was going to pay $2,000 for this, and I'm not going to see shit for 2 months, by that point I'd be like, well, that was a waste of money. I'd be discouraged. Are a lot of people discouraged because it takes so fucking long to work?
Sometimes yes, but sometimes people are lucky. By month 1, they're like, oh my god, I already see it, and if I'm not even done, and it's only going to get better, like I'm in. Because
by 2 months, I'm like, I don't even know. I don't remember what I looked like fucking 2 hours ago. Let alone
patience is a virtue. It's gonna look good.
I know. I'm saying that's what people are thinking.
I know.
But it's worth it in the end. I'm saying.
I mean, we gotta set expectations.
Yes.
Like that's half the job.
We don't want to lie to you and be like, oh my god, tomorrow you're gonna look like a movie star because.
So this is one of the dramatic ones. I saw this other one that on TikTok people are. They rips their whole fucking face off and they pull the whole face of skin off. Like, what is that called?
Are you talking about threads or are you talking about actual surgery?
It's like a mask of
like
skin.
The CO2 or the really abrasive one. It's like a peel. It's a chemical peel.
I mean, it sounds like you're doing more of a facelift. If you're like cutting skin.
No, it's not cutting skin.
It's a peel. Okay, so it's a chemical peel.
I think it's like some really intense chemical peel. Is this the most
dramatic one that people are getting done for the skin resurfacing?
No, you can actually do more dramatic stuff.
What are other options? Like, give us a more expensive option than than this, and
Yep.
a cheaper option. If someone doesn't want to do a full vampire facial, it's $2,000. That's too much. What's a more affordable skin resurfacing option that you can be doing? Maybe like the glow we're doing today.
Yes, so we're actually going to do a glow on you today. We're going to inject a liquid glower, a liquid hydrator. It's called Skin Vive, and it just came out.
Ooh.
So it's an injectable that's going to hydrate your skin, smooth your skin, give you a little bit more light reflection. It's a little bit more affordable for patients.
See? We come with options, Mama. For a low price right now, you can get your skin injected too, Mama.
So yeah, that will run you maybe like $500 for the year.
That's more
maybe
affordable.
6 months. You won't get as good as that airbrush look as you would with the microneedling. So I like to couple this with microneedling. But hey, if you want to start small, this is a perfect.
What's Morpheus 8?
So Morpheus 8 is the vampire facial on steroids.
We love.
Can I have that one?
Love that. Yes, we're gonna get you.
I want the
onto
most
that
expensive one.
Yeah, so that's the one that Kim Kardashian
Vinny
does
has
on
a
her
credit
whole
card
body.
he just got approved for.
Excellent.
Swipe.
So Morpheus is microneedling just like the vampire is, but the needles have this like heat energy that really kind of kill a lot of old cells and grow new cells. So it's
back rolls. Who's that up
Yes.
there? Can I see Morpheus 8 before and afters, Vin? I want to see what I'm getting myself into.
Amanda, may I have my phone? I want to show him a photo of
I know what we should do.
a Morpheus that I did. So you can
We're
get
gonna we have a we wheel and deal over here. I was able to wheel and deal for the Man Mafia, and we're gonna have some special deal happening. But maybe if I'm feeling generous, maybe we could do a raffle or something, Vin, where we can like raffle off like a Botox session or a vampire facial to one of the Man Mafia members.
I love
we have to
it.
think of a good contest, because that's expensive. I'll pay for it, but we have to like find something good for them to do.
All right,
I don't know if you want to put this on the screen, but this is a Morpheus that we did on a tummy, and it's almost like a tummy tuck. Okay, you can see how. So this is how we can really take some loose
that real?
skin. That's real. That's real.
You send it to me?
Yeah, I can send it.
I like how the options of panties this woman has. Right now, she has a micro micro thong on in the middle.
She likes to change it up. She's feeling herself
Here,
towards
Ben.
the end.
Wow.
Yeah, so we actually do Morpheus on
picture
a
is-
lot
it's
of parts
like
of the
loose
body.
skin.
Loose skin, especially for those moms after they have the baby and they have a little bit of loose
You know who's
skin
that
or weight
great for?
changes.
Who's great for?
Post Ozempic.
Post Ozempic and also
Yep.
post major Ozempic are just people that have a lifestyle change and lost a ton of weight
Yes.
quickly and lost the elasticity.
So we're actually seeing a
That's a-
slew of people that just took Ozempic, lost a lot of weight, and now they need a little tightening up on the skin that they lost fat.
That's
in.
insane, because
Yeah.
that is a very dramatic. So I had surgery like that when I after I had my
Top
my
surgery?
gynecomastia surgery.
Yeah.
With the whole skin, but skin removal surgery is a very intense
Oh
thing.
my God. Scars, the downtime,
Yep.
the pain. It's a lot. It's a lot. So yeah, this
So this
patient
is
came
Kelly
in.
Keith.
This patient came in, postpartum changes,
That's
not
is she
loving.
just laying down on the last picture? Is that why it looks flat?
No, she was standing up and
Oh,
built.
really?
Did she do
Yeah.
sculpt by chance?
She did not do M sculpt.
This
but
is your client?
She works out. Yes.
You did this?
This is my patient. Yes.
Oh my God.
This is my work. I can show you another one. I have a lot.
That is insane. Ladies,
I have a
again,
lot.
visual episode. Look at
Yes.
this picture.
This is
Can you
That's
imagine?
insane.
We do a
And just-
lot of this. We call this like the non-invasive tummy tuck almost. This
Now,
is Morpheus.
How the fuck does that? What is it? It
So look,
shrinks the skin?
Morpheus resurfaced it. So it took away that old wrinkly skin and now it replaced it with new skin that grew in. This was a 3 month.
Tightens it.
Yes.
Yeah, tightens.
This
you know
is
how we
a
were talking
3
about
month journey.
microneedling before, the vampire
We do that down
facial?
here so I can.
Do it anywhere.
Yeah.
I want. You know,
Anywhere.
I want to look like Bethany Frank.
Snatch.
I need a square head.
Yeah. So this
That
is
is,
amazing.
God, Vin. Is that ridiculous?
That is crazy.
Now, your girlfriend's coochie is stretched out like that as well. How does it work on the interlabial fold?
We haven't gotten there yet, but that's on the horizon, if you know what I mean.
Well, I'm impressed. I don't want to take any more time with you. I know we got a lot of work to do on Nana to overhaul her to one up old Trish. But if you're not already following Christina and Sperling Dermatology, go over to her page now. Look at her before and afters. You know me. I don't fuck around. I go to the best of the best. If I spend money I don't have, I am the most bougie bitch you'll ever meet. So I'm not having some hack job come in here to inject me. I seeked out the best of the best, and they just happen to be here on the East Coast. But like if she was in Beverly Hills, I would be flying there every
I appreciate
6 weeks to
you.
see her.
Thank
She
you.
is the best in the business.
Thank you.
She would not be touching Nana's face. This is my moneymaker.
yeah, that's
Okay?
right.
And I gotta handle it with care. Ladies, if you want anything done, hit up Sperling Dermatology. Do we also have a deal? Do you want a wheel and deal? Should we give him a discount?
Yes,
What do we
guys.
got? Gabby's gonna run a deal.
Yeah. So I am in our Midtown location, which is 37th and 7th.
New York City.
Yes. And if you book off of
Joey's
listening from
referral.
today,
Yeah, Joey, you're out and about.
You'll get $150 off of your
first
treatment, whatever it
That's
may
good.
be. Yeah.
Man, I was going to call that. I just want $150 first.
Yeah.
And actually, it could be for any location. You want to come to Red Bank, you want to come to Montclair. Gabby will be in New York City. We want to see you, Joey, for some Morpheus, for some vampire facials.
After I saw that bitch, I'm coming in for the Morpheus. Yeah, so go to hit up Sperling Dermatology.
$150 off.
SPE. Tell them where to find it and tell them.
Sperling Dermatology, SPERLING, Sperling Dermatology. Instagram, yes.
And they're all of their locations all over New Jersey and New York City.
Yep.
So hit them up, mention Out and About or Joey Camasta, and you're going to $150 off your first treatment. That's a big deal.
Yeah. And some other goodies if you're...
And then we're also going to do a thing. I want to do a raffle, maybe do a full judge on a Lucky Man Mafia member. But I have to think what the contest is.
Maybe Morpheus.
Maybe
Let's give a free Morpheus
Oh my
away.
God, anyone has saggy skin, bitch, hit us up.
Yeah.
But stay tuned for that. But we're going to get started now. I'm going to turn it over to Christina and Gabby to turn me into the swan that I am.
Let's do it.
Sounds good. Let's
The
do
ugly
it.
duckling to the swan.
Yes. All right.
And we have Gia coming. Gia's going to come in too. Gia just turned 25 this week. So for her 25th birthday, I think it's perfect time to get started on a little nip and tuck.
A little
Let's do it.
preemptive.
A little prick and poke.
Yeah,
I started getting
preventative
Botox when I was 21, so let's just do it.
Oh, she's a young
All
one.
right, let's do it. I don't think I've ever had. Did you do almond cream when I did my cheek injections? My jaw filler?
We did. Yeah. You loved it.
Oh, yeah. You never had anything done?
No, nothing.
Anything? You
Nothing.
never been poked in the face? It doesn't hurt. Botox is the only thing. The worst part of it is the hair and the crunch.
Crunch of what?
You'll see.
Oh,
It's
God.
the grossest sound
It's
ever.
fine. I feel like if I can get tattoos, like
It doesn't hurt.
Yeah.
It doesn't hurt at all. It's just you like when I hit the skin. It's like a you know pop caviar bead.
yeah.
It's like the same equivalent, but like on your skin.
Ooh.
It's gross. It sounds and the feel is gross because if you feel it, you feel pop, the crunch, you don't feel,
Yeah.
you don't feel it.
Okay.
Oh,
You good, P-Word?
Yeah, it's gonna get your mouth to talk, and then your inside of your mouth's gonna get numb. It's not a bad thing.
And then also
the numbing's really working.
It's very strong. This is the Morpheus numbing.
Oh my god.
Smile for me.
It's
Perfect.
like getting ready, mama.
20 for each side or 10?
This numb is
all together.
crazy. I can't feel anything.
Yeah, it's insane.
I can't even feel my fucking face.
Perfect. Yes.
They numbed me with a special number. Ladies, I can't even feel my head. It's like my whole head is off.
Draw it up. Yeah.
This is crazy.
So, a lip flip is different from filler. It's not a gel. It's a Dysport or Botox that goes into the muscle to relax your muscle so that when you're smiling or your lips kind of curl out a little bit. So what's funny is if you go to drink out of a straw or apply lipstick,
Remember I couldn't whistle?
yes, you're not going to be able to do that or it's going to feel weird to you.
I remember, yeah.
So don't freak out if
No,
you
I
feel
won't.
that.
I
You're
remember
like,
last time.
You're going to be like, am I having a stroke? But you're not. It's just a side effect.
So if you're a professional whistler, don't get a lip flick. You'll be
Or like
out of
drinking out of a
work.
straw,
Yeah.
drink out of like the side of it.
Yeah.
Okay, so what we're gonna do now is we are gonna contour Joey's cheeks. A lot of us, we start to lose a little fat and we start to descend down. So we're gonna give him a little cheek lift, a little contour to snatch his mid-face.
That's what I wanted.
I like to use a filler called Voluma. It lasts up to 2 years, gives you a nice, sick kind of snatch.
Am I pretty, mama? I love this shit. This hurts though. It doesn't hurt. You feel the filler. You feel like they put the needle all the way onto your bone.
Yeah.
And you feel the needle touching your bone. It's
Yeah,
disgusting.
you can hear it sometimes too.
Like a crunch.
Oh yeah, that's what he's saying.
This smells like bleach. I'm so sorry. Now it's important when we do a guy's cheek, we don't want to over feminize him. We have
You can
to.
be leaning it with it.
So it's interesting. A lot of people say like, I don't know about getting fillers if I'm a guy, and it's like, don't worry, we're gonna, we
So
have
you're
a
doing
different
straight
technique
instead
for
of angle. You're doing straight.
Right.
Do you guys do a lot of like straight men or no?
Yeah,
Yeah.
a lot of like business professionals, CEOs, like.
So I feel like there'd be
Gotta
like a
keep up with
stigma
the
against like
There
getting.
always is, yeah.
Yeah, I'm sure they don't tell anyone.
But once they start, they're more vain than their wives. They'll come in and they're like, oh, I'm not doing this.
I
for
literally just shoot my fiance
Yeah.
when I go
Yeah.
home.
Oh, that's
My
funny.
husband's
Whatever
addicted.
you think I need.
Yeah, that's funny.
But on the flip side, like women always think that like some people really need chin filler. That's like something that a lot of women especially get like overlooked sometimes when we look at their face. They really need chin filler to kind of bring their face to a more central point.
Yeah.
And a lot of women think like, oh, I'm gonna look like a man because I'm gonna have a witchy,
Good
pointy chin.
Yeah.
You would need like
So much.
a
Yeah.
lot of filler
Yeah.
to do that.
I ate it. So can you pierce my tongue now, too? I cannot
Imagine
believe
if that was
I cannot believe this numbing thing. It's like
so strong,
it's
right?
crazy.
Small pinch. Here we go. Okay.
Mhm.
Try not to move. There's that bone feeling.
I know, I felt it. It's gross.
So quiet.
Is that a good moan?
No, it's like feel it on your bone. It's so gross. Don't be scared, girls. That's the worst thing. Is you don't feel a thing. It's just you feel
Straight like that.
pressure on the bone.
You got a nice deep bone in there.
That's what she said. I look like I have palsy. Really want to smile.
Oh my god, you look fabulous.
No, you can tell the difference. I can't feel my fucking face.
Stop.
Yeah.
This is everything.
Oh, you can tell?
Yeah.
Where's
Hold
my
on.
mirror? Sissy?
Sorry, I'm just bleeding.
Oh.
I have to.
Oh,
clean it,
yeah.
Right? Look at you angling up.
See that?
I got tight on.
Yes.
I just gotta clean you. Sorry.
Bitch! I look like
I know.
the Wicked Witch of the West, Mama. I took Viagra last night. Maybe that's why I'm bleeding so much. I should be really vascular.
Look at that.
Oh wow.
Take a look. Here, you can show Gia. So this,
Oh my god, wait, you're slaying.
and that's just cheek.
Thanks.
It act like you can really tell a difference.
It's insane.
You look so good.
See how he's lifted?
Come on, Snatch.
crazy.
Come on,
Right?
lift.
Oh, yeah.
Now look how it
That's good.
slims his lower face, angles it up.
Do the other side.
Show this camera.
So
Joey's the king of the smiles.
You got hard bones.
yeah,
I
look
know.
how that needle bent.
Ew! Whittling bone syndrome?
Now, do you have osteoporosis?
Do I? Is that what it says? Is that what
I'm
it says it
just
looks like?
kidding. No.
Oh my god. I didn't take my
Tell them
Boniva.
your filler syringe.
I need Boniva. How do you make sure they're not crooked?
Well, the drawing helps me, and also I continually look back and forth at your anatomy. And it's also your anatomy because like your bones are different on each side, so I have to account for that to make it look even. I'm so sorry. I know this one hurts.
People
Okay.
pass out a lot from just watching.
Usually it's guests or
Really?
like
Yeah.
husbands or like friends.
Really?
Yeah. It's not usually the person getting.
Oh, because I don't see it, so I don't know what it looks like. Is it scary looking?
No, it's fine. It's just the last one kind of looked weird.
Stop making them talk about it.
Okay, we are going to move towards lips now. We are done with your cheeks. If you want to take a look at that,
Oh, I love it. And it's still swollen, but it's...
yeah,
Should
it's
you
definitely
just
going to
go
go down. We're going to start
look
icing
this
you.
way.
Sorry.
Nice.
Okay, you are getting Juvederm Ultra in the lips. I love this one. It's not too thin, it's not too thick. It's kind of down the middle and very natural, sultry. Okay, so you're going to open your mouth slightly.
She wrapped my whole head in gauze. You know?
Yeah, like a mummy.
When I come out, it's the new Jan Brady. Mm.
No.
Oh.
I'm not gonna do that.
For Botox, it's not.
The Botox doesn't hurt at all. Oh. I think I just came. I'm like, kidding. I can't feel my head. Do I look like I'm walking the glory hole?
Take a look.
I reset.
They're done?
And then
Almost.
Now I have
Well,
a
you
full
tell
sleeve.
me, because I could go bigger.
They don't look
but-
crazy, right?
Well, I don't want to tell it because...
Natural.
No, it's good.
Oh, it's so good.
Now they're swollen. They
They
will
are
go
swollen,
down.
so they're not. So
Oh,
should I do
yeah.
more then if it's gonna go down?
I could do a little bit more. It is going to go
Yeah.
down a little bit from that.
You almost did a full syringe.
I almost did. Oh yeah, I can finish it up. There's
You don't want to
only
finish
a
it? It's like
smidge.
Just finish it,
0.15
yeah.
left. Yeah.
Just finish it, bitch. Let me
I
get
like
some
it.
alcohol.
Okay.
Gosh.
Clips. Okay, we're done.
Done? Okay, good.
Okay, this is the skin glow medication. So it
Does
kind
this
of
hurt?
feels, it doesn't hurt, but it feels like kind of Botox, like do,
Okay.
like that. This is for your skin glow, for your texture, for your dry patches. Sorry.
Oh,
Okay, we're done with that.
gross. And that's just a sign that that's done?
Yep.
Oh my god. This is a lot for one day.
Are you crying?
Am I?
A little bit.
Oh yeah.
All right, we're gonna have to
Move?
maybe shift rooms.
Why?
Large has to come in here. And
Why does he can't use that one?
someone's in there, and like he's crunched for time as a guest. So we're
Right now? Oh.
Okay, we're done. No more.
Okay.
Smile. Nervous?
I'm very nervous, especially after seeing Joey moaning and groaning. But they keep telling me that mine's like not as intense as that. He got filler. I'm getting Botox.
He's
so
also gushing blood.
I know, which is like I don't know if I'm gonna be okay. I don't want to. I don't want it to hurt, and I feel like it is.
We got kicked out. But thank God that Eric is gone. Now we can use this office. Not thank God. I miss you, girl.
And then Gabby, can I just get a gauze with alcohol?
That feels so much better.
Okay, Joe, you're all done.
Thank you.
You're welcome.
Gia.
2 times.
Hey.
Bye-bye.
I'm getting Botox.
Okay, cool. Just Botox, right?
Yeah.
I just saw Joe and I was
No. Yeah.
He did a lot.
Yeah.
but
yeah.
But
he's no
that's
stranger.
Joe.
He's no stranger.
Yeah.
She's just doing a little Botox.
I was like blacking out, being like, how am I gonna explain to Fran how I let her get an injection?
Oh my God.
When she comes
No,
in.
I'm just getting a lip flip.
Yeah.
Yeah.
What?
So it's
What
just
did
like
they
the
do?
top, your top lip, like, just gets a little bigger.
Oh, okay. Sure.
Yeah.
Okay, girl. You
Gia's going to Paris. This is her Parisian
I
hope.
said I couldn't. I hear her. She's saying lip filler. How am I gonna explain that to Fran that I let that happen? She's
Yeah.
not
I
here.
know.
Is he going to be bruising on the lips?
Nope. For you, yes.
Yeah.
For her, no.
Suck it.
We're done,
Wow.
right?
That was so easy.
All right?
Easy.
I'm just gonna clean you up.
Oh, you did lip flip too?
Yep.
Well, Gia, how'd it feel?
It was so easy, like
Yeah.
easier than I thought, because you kind of scared me with your moaning, but mine was like 30 seconds.
Yeah, Botox is like Botox and Dysport. It's like a cakewalk compared to the other things. I just say the filler, it doesn't hurt at all. It's more of a sensation of like the feeling the pressure on your bone. Like if you take your finger, put it on a bone, it's like that's what you feel. It just feels unnatural. But yeah, it's not painful. It's just like a lot in one day. So maybe I would suggest maybe like kind of spreading it out. But I know that in like 2 weeks I'm gonna look brand new. Just keep watching this program just to see my progress. But I cannot thank Sperling Dermatology enough. Thank you, Christina.
Thank you so much. Thank you for having me.
Yeah,
Thanks
Yes.
for coming. Again,
Yes.
again, we're telling about the
Yes,
Thank you, Gabby,
$150 off your first service if you call in and you say you saw us on Out and About or with Joey or with Gia.
Oh my gosh,
we
that's a great deal.
Yes, we can see you at our New York office. We can see you at Red Bank, Montclair, any office that you'd like. So,
Well,
yeah.
thank you for joining us. And
Thank
girl,
you.
Man Mafia, get out there and get yourself poked by a professional. You're
Yeah.
not just see. And thank you for joining us. We wish Trish a happy recovery.
Yes.
She'll be back next week.
Bye,
and
Pat.
Chin up, panties down, girls. It's Friday. Go out there and while out. Love you, girl.